Hello, my name is Susanna Arkelian, and the topic of my presentation is cerebral palsy, also known as just CP. First off, what exactly is cerebral palsy? Let's break up the words. Cerebral means pertaining to the brain, and palsy means weakness or problems with using the muscles. So cerebral palsy is a group of diseases that affect muscle tone, movement, and motor skills. It is one of the most common neurological deficits in childhood. In this presentation, I'm going to review some statistics about the illness, then describe the various different types, risk factors, causes, and helpful treatments. Here are some pictures to help visualize what CP might look like in young children. According to the Centers for Disease Control and Prevention, cerebral palsy is the most common physical disease in childhood, as it affects 17 million people worldwide. It affects 1 to 4 in 1,000 births around the world, and 1 in 323 births in the United States alone. Here are a few specific statistics regarding the disease. 1 in 3 patients are unable to walk. 1 in 4 are unable to talk. 1 in 10 have a severe vision impairment. 3 in 4 have chronic pain. 1 in 4 have seizures, and 1 in 2 have intellectual impairments. Generally, the more severe a person's physical limitation is, the more likely it will be that they have an intellectual disability as well. There are unfortunately many different variations to cerebral palsy. The first and most common is spastic, that affects about 80% of people with CP and causes stiff muscles by affecting different parts of the body. Spastic CP has 4 subdivisions to it as well: monoplegia, hemiplegia, the most common of the 4, diplegia, and quadriplegia, also called tetraplegia. The second type is dyskinetic CP, which involves uncontrollable movement. The third type is ataxic, which is the least common and has to do with poor balance and control. The final type is mixed, meaning that some individuals may have more than one of the previously mentioned types of CP. Here's a good illustration showing the 4 different variations of CP, all depending on what region of the brain is affected. Let's start with the pictures by going left to right. We can see that spastic CP is caused by damage in the cerebral cortex, dyskinetic CP is caused by damage in the basal ganglia, ataxic CP is caused by damage in the cerebellum, and lastly, mixed CP is caused by damage to more than one area in the brain. This figure shows the motor types of cerebral palsy all in one, so you can compare the areas of brain damage and see exactly how they're going to correlate with limitations of the disease. As mentioned earlier, spastic CP affects 70 to 80% of patients, whereas dyskinetic and ataxic each affect 6%. Here's another diagram showing the sublevels of spastic CP. Again, we'll start from left to right. Spastic monoplegia affects only one limb. Hemiplegia affects one side of the body, either left or right. Diplegia affects the lower half of the body. This includes a difficulty walking because the muscles of the legs and/or the hips are too tight. Lastly, quadriplegia is the most severe of them all, as it affects the entire body, and it often includes other developmental disabilities as well. There are some risk factors that can increase the chance that a child will have cerebral palsy. First, males are more likely to be affected by the illness. Others who are more likely are premature babies, babies born before the 37th and especially before the 32nd week of pregnancy, those with low birth weight, babies weighing less than 5.5 pounds, especially less than 3 pounds at birth, and those whose mothers had infections during pregnancy, as infections lead to increased proteins that flow in the brain and blood of the baby in the womb. There are many different causes of CP, which can occur before, during, or after birth. Congenital causes happen 70% of the time and include hemorrhages, bleeding in the brain while in the womb. During birth causes happen 20% of the time and include asphyxia, severe lack of oxygen in the brain, and other injuries. Lastly, acquired causes can happen again after brain injuries have been suffered, or infections such as bacterial meningitis have been acquired. The pie chart on the right shows the breakdown of these 3 categories. Early signs showing the presence of cerebral palsy. These include a delay in development, such as not walking and talking on time, low muscle tone, muscle spasms, lack of individual head support, and difficulty in eating and/or swallowing, among many other things. Lastly, what can be done to help cerebral palsy? There is unfortunately no cure found yet, although research is being conducted, but there are still helpful treatments. These include physical therapy to improve strength, mobility, and posture, occupational therapy to help with everyday tasks such as picking up small objects, speech pathology to improve communication skills, medication to help with seizures, and surgical procedures to help with spasticity and stiffness. This concludes my presentation. I hope you have enjoyed and found it informational. The future looks bright. I am hopeful that one day a cure for cerebral palsy will be found, and it will help better the lives of millions of individuals all around the world. Thank you.